Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, hiatus hernia, treatment of hiatus hernia. Right. In the treatment of hiatus hernia, first we have surgical approach for the treatment of hiatus hernia. Surgery is done for the treatment of hiatus hernia, where we can do a transabdominal or transthoracic surgery can be done by either laparoscopic method or open method. But what is mainly preferred? A transabdominal laparoscopic approach is mainly preferred for hiatus hernia. For hiatus hernia, a transabdominal laparoscopic approach is preferred for hiatus hernia.
thank you and thank you for watching.